So, GERD, gastroesophageal reflux disease. A lot of people have GERD. It's the most common upper GI problem in adults. Things that can cause GERD could be a motility issue, problems with the esophagus, problems with food actually moving down through the esophagus into the stomach could be a motility problem. Could be the patient has a hiatal hernia. Hiatal hernias will cause GERD. Not all patients with GERD have hiatal hernias. Most likely the patient has problems with their lower esophageal sphincter. This is a sphincter that should stay closed between the esophagus and the stomach. If it flops open, then that's what causes the regurg. Acid regurges, goes back up, and it's causing irritation to your esophagus. Some patients have problems with gastric emptying, so they keep a lot of gastric juices, food in their stomach. It doesn't go on down through the duodenum. Some people just have they make a lot of hydrochloric acid, too much. So that can cause esophagitis and breakdown of the lower esophageal sphincter. Different issues can cause it. A lot of people have different problems. So the kind of problems the patient they have are pyrosis, another word for heartburn. They have lots of heartburn. They may have difficulty swallowing, meaning the food will get stuck in their esophagus. So dyspnea, regurg, that feeling of food coming back up into your throat and esophagus, very high acidic stomach. The globus sensation is patients feel like there's a lump in their throat caused by the regurg and the lower esophageal sphincter not working as well. These are all symptoms a lot of patients have. So a way to find out if this is the problem and if they have regurg and they have GERD and what's going on is let's do an upper endoscopy or an EGD. They may also do manometric studies. These are studies that find out the motility of food down the esophagus. They may do a pH study. Patient swallows a tube, like an NG tube down the nose, and it basically records your pH value of your stomach contents. Is your pH too low? Is it way low? Is that what's causing it? Things like that. So different studies. Most common is your upper endoscopy study. So for a patient that has GERD, we need to start low and work up to the more extreme measures. So the step approach for acid regurg is, let's start with an antacid. An acid like Tums, over the counter. If that doesn't do the job, the patient may need over-the-counter H2 blockers. That should say H2 blockers, not HT blockers. So over-the-counter Prilosec. If those aren't strong enough, then let's give a prescription of H2 blockers. The top of the heap is proton pump inhibitors. I'm sorry, I said Prilosec on H2 blockers. Prilosec is not a proton pump inhibitor. I'm sorry. Prilosec is not an H2 blocker. Proton pump inhibitors, what Prilosec, Nexium, those are proton pump inhibitors. So we work with the drug that works for the patient and build up. So complications for someone that has GERD, lots of complications. They have esophagitis, meaning the inflammation of the esophagus because of the irritation of the acid. Over a long period of time, something can happen called Barrett's esophagus. The acid will actually change the structure of the cells in your esophagus. If someone gets Barrett's esophagus, they are going to lose the motility in their throat, in their esophagus, and they may be reduced to only eating soups, things that will just naturally creep down, and you don't need that peristalsis in your esophagus. Obviously, a high risk is aspiration. People that go to sleep, they have GERD, they can aspirate. The other thing is esophageal strictures. The acid can cause blockages in your esophagus. The patient has to have like an angioplasty, but it's in the esophagus. They open it up with either balloons or different tubes that are larger and larger. They may have motility problems. These are all issues, complications for GERD patients. So treatments. Well, the best thing is lifestyle changes. There are certain things that affect your lower esophageal sphincter. It's not very fun, but the patient may have to cut out alcohol, tobacco use, chocolate, peppermint, caffeine. These are things that make that sphincter not as does not work as well. And they will find that when they consume any of these products, they have a higher incidence of heartburn, regurg. They also probably need to change food. Spicy, high-fat foods, milk products, especially at bedtime. Spicy, high-fat foods will cause an increase of GERD symptoms. Also, when the patient eats, later they eat, the more complications they'll have because they'll be lying down trying to sleep. A cure for GERD is having a Nissen fundoplication surgery. This surgery is for patients that have hiatal hernia or GERD. They basically wrap the stomach around the diaphragm at the top. It tightens up the sphincter and it will stop hiatal hernia symptoms as well as GERD. But it's a major surgery. The other thing you can do for the patients that have strictures is the esophageal dilation, using either the Celestin tubes, which is one tube that's small, then they put another tube over the top of it, and it's larger, and another one over top of that, so it slowly widens up the stricture. Another way is doing a balloon, so different doctors either use the tube or the balloon. Other things that the patient needs to do, lifestyle changes. Patients shouldn't be eating any of these things. They should watch what they eat. They shouldn't eat past 6 o'clock or 7 p.m. if they're going to bed at a normal time. They should raise the head of the bed up 6 to 7 inches so gravity will help be their friend so they won't have the regurg during the night. They do need to do a lot of lifestyle changes, especially if they eat or drink any of these things. Or they can just live with it and, take their medication, take a lot of Tums over the counter and just try to work with it. The problem is the longer you have symptoms and the worse they are, then you have a higher risk of developing Barrett's esophagus. Barrett's esophagus, once you have that, you're at a very high risk of forming esophageal cancer. So different kinds of cancer in the GI. You all know about these: oral cancer, esophageal, stomach, pancreatic, liver, colon, and rectal cancer. All cancers of the GI system. So oral cancer. What are the highest risks for oral cancer? Tobacco use, alcohol use. One of the early signs is something called leukoplakia. It's like a white spot on your tongue or your gum or your buccal area. It's a form of the cancer, and people don't recognize for what it is. You can't scrape it off, but leukoplakia, these white spots, that is usually the first sign that you're probably going to get oral cancer or you've got oral cancer. The other issue that comes with oral cancer is dysphagia, difficulty swallowing. It'll spread to your throat and you can't swallow. Surgery is what is the best thing, especially for patients that get lip cancer. The number one risk for lip cancer is using spitting tobacco, chew. Bad thing about oral cancer is that metastasizes early to the lymph system. If you go to the lymph system, it can go anywhere. Oral cancer, since it's inside around the mouth, it's got a very high lymph system. Think of all of your lymph glands that are all over around your jaw, around your neck. Those are the carriers for metastases. So diagnosis is going to be a big issue eating enough food, lots of pain. If somebody has oral cancer, you can see it on their face. If they have surgery, they have a disformed lip or mouth or jaw. So that big body image area is going to be a big factor.